Hi there. Welcome back to Life Reconsidered. Dr. T here. I want to say thank you to everyone who has subscribed to my YouTube channel. And if you haven't done so, please do so because you don't want to miss out on another educative video. Today, we want to continue our conversation about triggers and understanding all about triggers and how to manage our emotional responses to trigger points. The most common symptoms or reaction to trigger points are feeling anxious, sadness, feeling scared, having panic attacks, or feeling unsafe, like your life is in danger. Other symptoms include having heart palpitations when your heart is beating very fast without any medical reasons, when your body is beginning to sweat, particularly your palms, when you're having difficulty breathing, feeling like you want to escape the scene or you want to avoid the scene completely. Some of my young people tell me it feels like there's a butterfly in their tummy. And adults can feel like that too. Or when you're having sudden headaches, feeling lightheaded, when there's tightness in your neck area, in your jaw area, or clenching your fist, and when there is tightness in your vocal cords and making it difficult to speak. And these symptoms are, sudden, and it's not necessarily due to the circumstances that you are facing or dealing with in the moment. It's due to responding to a trigger point. The circumstances may remind you of a previous trauma, and therefore you are not necessarily responding to that circumstances in the present moment, but you are reacting based on a previous trauma. Now, the question is, how do I know I'm triggered? Or how do you know when you are triggered? How can we tell when we are triggered? Now, like what we said last week, there are some basic characteristics of triggers. And one of those characteristics that tells us that we are triggered is that when the emotional responses are sudden, unpredictable, and spontaneous. That's how we know they are triggers. The most important thing is that those emotional responses are not related to the present circumstances you are dealing with, like I said. The circumstances are reminders of some trigger points that the brain has stored previously because of a trauma that we went through. So when you are in the presence of an event or a circumstance, it's a reminder. It's almost like the brain mapping that back to the trigger point and therefore eliciting those intense emotions that comes out of us. So remember, emotional responses are unpredictable, they are spontaneous, and some of them can be very explosive. So please pay attention to that. Another question that we want to tackle today is, how do I deal with triggers? Whenever you are triggered, it is important for you not to react impulsively. You want to take a step back. You want to use breathing techniques to make sure that you are calming yourself down. And when you find yourself in a safe place, then you can process what happened. It's also good if you can remove yourself from the situation to do so. Apart from taking a step back, breathing techniques, and removing yourself from the situation, you can also use any coping skills that you have learned prior to as intervention to help you. reduce the intensity of the emotional response. Some people think about a safe place, their last vacation. Some people count 1 to 10 backwards because you need some mental faculty there. So they trick their brain instead of the reactive part of the brain, the limbic system taking over. They trick their brain to use a little bit of cognitive processing to start counting backwards, thereby slowing their responses and slowing the intensity of their emotional reaction to the trigger point. Okay, one thing that we need to know is that responding to trigger points or trauma trigger points are complex. So it is important for you to learn your body, understand yourself, and know how you respond. Because our responses are going to be totally different, even if we are faced with the same trigger point. How you will react and respond is going to be totally different from how I will react and respond. So it's important for each of us to understand our body, to read our emotions, like I said, to find out some trends and patterns to help us develop healthy coping skills to be able to use them to reduce the intensity of our emotional responses. Another thing you can do is that take care of yourself. Now, if you haven't listened to my previous video on self-care, I will encourage you to do so. It is important for you to take care of yourself. And that's because anytime we respond to trigger point by experiences intense emotional reaction, it comes through our body. We have physiological responses, the physical aspect, like we're talking about. So it's very important for you and I to take care of ourselves, especially after an episode of an emotional reaction. Another thing you want to do is that talk to a professional counselor or a clinical social worker or psychologist or psychiatrist so that they can help you understand what your specific trauma are, your specific trigger points are. For instance, if your trigger points are rooted in mental health illnesses or in recovering from an addiction or recovering from eating disorder, or wherever your trigger points are rooted in, you want a professional to help you understand those better so that you can help manage your trigger points. Now, the final thing you want to do is that you want to use support groups and support networks in your community. If you don't have those, that's fine. You want to identify your safe people, your safe circle of friends and family. And you want to trust them with how you are feeling, what you are dealing with, so that they can help guide you navigate what you are going through. That's all for today. Thank you for joining me today, and thank you for sticking out with me. See you another time. And don't forget, if you have any question, email me at mylifereconsidered@gmail.com. Thank you. Bye.